I am Thierry Facon. I am a professor of clinical hematology at Lille University Hospital in France, and I am a member of the French myeloma group, known as the IFM group. The background is that we, some years ago, 5 to 10 years ago, we established melphalan, prednisone, and thalidomide as a standard of care in newly diagnosed elderly myeloma patients. And for example, in Europe, the thalidomide approval was based on an IFM study, which was an academic study at the beginning. And so we, around 2006, 2007, we decided to move forward with another study, and we took the MPT as a control arm. And at that time, if you remember, we heard that low-dose dexamethasone was better than high-dose dexamethasone, and we took, as an investigation arm, we took the lenalidomide and low-dose dex. And so we decided to move forward with this. The IFM designed a study, and then IFM discussed with Celgene, and Celgene say, okay, that could be an even better study. So we will do that as an international study. And so the study was chaired by IFM, but this is a very international phase 3 study. So basically, the MPT was the control arm, and we investigated 2 lenalidomide low-dose dex arms, one for a fixed duration, 18 cycles, and another one as a continuous therapy, so just as a continuous lenalidomide and dex until progression. And so at the end of the day, we enrolled 1,623 patients in 18 countries, in fact, and we were able to show that basically lenalidomide and low-dose dex continuously is a better regimen than MPT. So the study has potential important implications in many countries. People will say that the impact in the US may be a little bit lower because they already have lenalidomide in a frontline setting. But anyway, some US doctors say that that could have an impact in the US as well. And that was said this morning during the press conference, for example. But in Europe, we may expect an important impact, assuming that EMA will approve this regimen. So that's another story. But if approved, and it's likely that it will be approved, that will have a great impact in Europe, and probably also in many other countries. So because the lenalidomide is available in relapsed myeloma in many countries, and we may have an approval also in the frontline setting. For example, in China, they have approved recently lenalidomide in relapsed patients, and they were part of MM-020 study, so they may get approval in a couple of years in the frontline setting as well. You know, the study was a quite risky study because the control arm is a strong control arm. As you know, in the past we had melphalan prednisone, and we did a lot of studies investigating melphalan prednisone and thalidomide, melphalan prednisone and bortezomib, etc. So the control arm was weak, and so that was quite easy to show superiority. But as soon as you take MPT as a control arm, and if you take VMP as a control arm, it's not so sure that you will achieve the survival benefit, for example. So the study was let's say a little bit risky or a little bit challenging. And also importantly, if you look at this study, the MPT control was quite good. So the median PFS in MM-020 for MPT was around 21 months, which is not bad. And the good news is that even with this strong control arm, the lenalidomide and dex continuously was best. And it was best also not only for the PFS, which was the primary endpoint, but also for the survival and for other secondary efficacy endpoints. And in terms of safety, len low-dose dex is safe. So we know that from the past because this regimen has been used in relapsed myeloma, but there was no safety concerns. In terms of SPM, which has been something a little bit controversial in the past few years, we got very few hematological SPM in lenalidomide low-dose dex. Only 2 patients out of 500, more than 500 patients. So that's really the bottom line, and we got some in the MPT, but basically lenalidomide and low-dose dex is manageable and safe.